I am Maria Aramburu. I'm a pediatrician in Washington, D.C. at MedStar Georgetown University Hospital, and I'm the co-chair with Dr. Anjali Malik of the Women in Medicine section for MSDC. And we're so happy to be hosting Dr. Freyden today for this wonderful topic. So I wanted to tell you guys a little bit about the Women in Medicine section first, and then we'll go ahead and introduce Dr. Freyden. So we realize that the number of women in medicine is steadily rising, and now more women than men are enrolled in medical school. So MSDC's Women in Medicine section is a physician-led group that works to increase the number and the influence of women physicians in leadership roles, both within the greater DC medical community and MSDC, but we also provide mentoring and networking opportunities for women physicians. This year, we have hosted webinars on the plight of women in the pandemic, plight of women in academic medicine during a pandemic, imposter syndrome, and now we're hosting this great topic of parenting in a pandemic. So it's been greatly relevant during these times, and we've been recording these sessions, so even if people don't get a chance to join because they're very busy with homeschooling and virtual learning and everything else, they can access the webinars at a later time. And we've also seen a lot of that. So it's great. And the feedback has been great. So welcome, Dr. Freyden. Dr. Freyden is also a pediatrician. She's a mother and a child advocate, and she's based out of New York City. She was inspired to pursue medicine after surviving childhood cancer and uses her experience as a patient to be a more empathetic physician. And I think that's so great. She graduated Harvard College with undergraduate, and then she studied psychology there. And then she went on to do a doctorate at Columbia College of Physicians and Surgeons. And she is the author of Parenting in a Pandemic: How to Help Your Family Through COVID-19. I think especially for women physicians, this is a very important topic, Dr. Freyden, and everybody will benefit. So I'll give you the mic. Welcome.
Thank you so much. Thanks for having me. So maybe I'll start by just telling you a little bit about my professional career so far. So, undergrad, when I was doing my thesis in psychology, I actually pursued a study about the biopsychosocial response to stress. And I can't actually think of a better background to have in terms of talking about what all of us are going through during this pandemic, because we're all facing such extraordinary stress. So, after I did college, I did medical school in New York, and then I went on to be in academic pediatrics at Montefiore Children's Hospital as part of the complex care pediatrics group there. So complex care pediatrics was taking care of the very sickest children, both in the hospital and as primary care. But actually, because it was such a big job, those people are in the hospital all the time and lots of very serious emergencies, I ended up transitioning to school health about 3 years ago, where I served the same population, really, the sicker children, doing care coordination and public health preventive work from the schools in New York City. And so I went from having 100 patients that I know very well to having about 200,000 patients that attend my schools in the South Bronx. So it's like a totally different approach to doctoring, because you can never do everything. So you're just trying to target your work towards those who need it the most. And so it was with that public health sort of lens that I saw the pandemic unfolding. So I think because all of you are physicians, you probably have read a lot about the science of coronavirus, because it's relevant to what you're doing day to day, and it's relevant to your family's decisions. In the book I wrote, I do spend like about a third of the book reviewing that for lay people, like what you need to know to understand coronavirus. But I'm going to skip past all of that because I think most of you get the basics, how to get diagnosed, how is it spread, those sorts of things. So I just want to say, though, that keeping up with all of the news about the pandemic is a stress in and of itself. So many physicians are overwhelmed with the constant barrage of information. So if you're trying to work full-time and you had a full-time job before this, now processing all the news and the new information coming is like an additional hour a day, almost, it seems like. So I'd like to give just a couple tips, having spent a lot of time digesting coronavirus news, that some of the most high yield uses of your time, if you're trying to keep abreast of what's going on. This Week in Virology is a really great podcast that goes through the most pertinent studies that come out every week in a very academic and science-based perspective. The UCSF Grand Rounds series is also a not to be missed if you're worried about school health in particular, because they have been leaders in helping us stay abreast of the science as it affects children. And funny enough, Facebook actually has been an amazing resource during this time. There are all these physician groups for coronavirus there, and they're always talking about the newest studies and sharing the most relevant articles. So even, if you don't see something, you'll probably see it come up there. So I would love to recommend those resources for you. So, you know, because of because of our jobs as being physicians, we're actually under more stress even than most parents. So I'm going to start by talking about how we cope as parents and as physicians. Um, you know, there's also a resource I wanted to plug. There's a national physician hotline for doctors who are having mental health concerns, and it's anonymous, and it's almost 24 hours a day, staffed by psychiatrists. And these people have volunteered their time because they see it to be such an urgent priority to meet the mental health needs of doctors right now, because, we're all so stressed about everything. So let me just get the next page up here. So in terms of coping, before you really dig too much into it, you want to find out what it is you're struggling with as a parent. So I'm going to go through some of the different issues I've heard. So I have this Instagram following now of about 12,000 parents, and they're always telling me how they're feeling. So I'm going to guess that you're feeling similarly and address some of the common themes I've heard from them. So one big category is feeling guilty. So some people are guilty because their job is interfering with their parenting duties. So work-life balance is always a struggle, but now we have fewer opportunities for our children to be in school or in activities that we really value. And because of that, it's natural to feel guilty when you can't just step in to be the homeschooler and replacing all of these other resources we depend on. So I think it's important to acknowledge when you're feeling that tension, because sometimes when we encounter hard feelings, we try to just ignore it and hope it will go away, or we try to dismiss it as like, I can't deal with that right now. But before you can really feel better, it's important to just, acknowledge that that's one of the emotions that's getting you down. And then you have to come up with a way that you're going to remind yourself that your priorities and actions are intentional. So, you made your choices about your work-life balance and your child's activities before the pandemic happened and everything changed. So it's not your fault, if you're not happy with the plan that you have now, because it's not what you chose. So I've heard from parents that it can be helpful to have a mantra, whether it's not my fault, or it's not forever, or something along those lines, that we're doing the best we can. Something that when you feel that guilt bubble up, if maybe you see on social media your neighbor is doing fancy homeschool science projects and you just don't have the bandwidth for that, you can say, like, just doing the best I can, and try to release some of that tension. I think also speaking with people in similar situations, like your colleagues or friends, can also provide a reality check that sometimes the expectations are unrealistic. then there's also like another layer of guilt that physicians in particular face, like a survivor guilt or an existential guilt. So we've seen obviously a lot of patients dying. We've seen colleagues dying, and it's very upsetting. You know, we've seen the disparities worse than ever in terms of death rates, and it's unfair and it's very upsetting. So I think that this kind of big picture existential guilt, we may as doctors be more aware of it than other people, and it may be hitting us a little bit harder. So I think identifying that that is what's upsetting you can help you process it, because you can remind yourself that you're taking discrete steps and just going to work to try to do your part to help. And even if your work is not directly patient facing, obviously, you know, you're still doing something to help keep the healthcare system in place and operational, and that matters. The next thing I've heard a lot is lack of control. So many parents feel anxious and stressed, and they kind of immediately jump to, oh, I'm worried about getting sick. I'm worried about my kids getting sick. But sometimes it's not actually that we're worried about the virus. It's more that we're disoriented by our inability to control our lives. So I think what if you're feeling frustrated by the lack of control, there's a few things you can do. One is to sort of journal or write about it. So you can say, you know, um, I feel like I can't plan ahead to any vacations, but then what can I plan ahead? You know, I can plan to see someone socially distanced, or I can plan some things to look forward to. And writing it out can help you have more of a plan and feel more of a sense of control. Another outlet for that is finding projects that you can feel a sense of control over, whether it's as simple as like cleaning out your pantry or like accomplishing a small task. Being able to find kind of like something you can concentrate on and focus on can help you feel more control over your life. Let's see. So grief is another one. So in the book, I share that it's sort of silly, but my son was supposed to be in kindergarten this spring, and I had really been looking forward to his teddy bear picnic and his kindergarten class play and all of these little cute little things he was going to get to do. And uh, I'm well aware that the world is in turmoil and the class picnic doesn't matter at all, but it's okay still to admit that I was disappointed to miss that, and disappointed that my son couldn't have that experience. So I think sometimes as parents, or we see our children feeling grief about some of these disappointments, and rather than belittle that feeling or try to push it away, again, to really just like allow it to be and to allow it to sit, because that's the only way you could work through some of these painful experience, feelings, is to really feel it and understand it and move forward. So particularly when your children are dealing with grief, especially older children like teenagers, it can be very draining for you as a parent, because really the best thing you can do is listen, and you can't fix it. So by having to deal with that and take it's another burden that you have to carry. So just to be aware of that it is draining, because sometimes if you don't recognize it, you may not act the way you want to as a parent. You may find yourself getting angry or dismissing your child's feelings. But I think it's better to just say, wow, like, you are really upset and I am having trouble handling that, and give yourself a break. I think it's also worth mentioning that in terms of those emotional loads, we all carry, sort of empathy fatigue and overload that we bring home from work too. So most physicians have some kind of ritual for leaving work at work, but I think it may be more important now than ever to give yourself time to transition between environments. So you may be in clinic all day, and then you may need a break before going home and just jumping in with your kids. And it's okay if you need a break, and to prioritize that self-care. even just to call a friend or play a game of Sudoku or whatever it is you do to unwind. It's hard to spend time when we're also overstretched, but it's worth investing in. Other simple wellness tips are worth reviewing. And I know you're doctors and you know this, but sometimes we are the worst patients. But things like caffeine and not getting enough sleep will make you feel more anxious and depressed over time. So prioritizing those simple things will help you feel better. Also, trying to find time to eat well and exercise. I know you know, and I know it's difficult, but I think it's important to prioritize. It's worth reminding you that you're kind of the role model for your family. So they'll see your choices and how you take care of yourself, and you'll set the tone. A lot of parents are disappointed with the way their community is handling coronavirus. So I can imagine that some of you are frustrated that your neighbors aren't taking the same precautions, or maybe you're annoyed that your child has to wear a mask in a certain situation where you don't think it's necessary, or whatever it is. I think it's important to realize that you set the tone for your family. So your attitude is going to influence the way your children respond to some of these situations. So, along those lines, when you're transitioning from being more locked down to less locked down, it can be helpful to have a conversation with your children about how you're approaching the pandemic, because a lot of children, when they're re-entering school or going out more than they've been used to, children are feeling anxious, and we kind of have an opportunity to set the tone for the changes as they occur. I think we also have an opportunity to show our children that it's okay to struggle and to fail. So a growth mindset has been a real buzzword in parenting circles, and I think it's for a good reason, because we know that taking chances is essential to learn, and we want our children to have that attitude as well. In regards to the pandemic, I think when you're struggling with something, whether it's having the time to do all the things you need to do, or feeling isolated or feeling anxious, I think it's important to share with your children, especially ones who are older, what you're going through, because they can learn from your experiences. So if you have the bandwidth to admit to your children, like, this is a really hard week because I've been working a lot and I need your help, and you can ask your children for help. They can learn from how you approach hard times, how they can approach hard times. So let's see. I think it's also helpful for children to know that when things are bad or they're hard, you can keep trying even when things are hard. And talking about this with your children can be really helpful. I'm going to get into more about how to talk to your children in a minute. But before I get there, I just want to address the reality that there are fixed resources for all of us right now. So we simply don't have more hours in the day, and we have more responsibilities than ever. So when we're in this situation, it's obviously like inherently very stressful. Um, but it's not our fault that we're in this situation. It's a pandemic, and it was unpredictable, and here we are. So we have only a few choices that we can make when we're stretched in that way. We can pick our priorities, and in picking our priorities, we can prioritize our energies. So say for your family, especially as you approach a new school year, maybe you're focused on helping your 5-year-old learn to read. Maybe you're focused on making sure your teenager doesn't fall more behind in math. I think for each family member, it's helpful to have an idea of like what is really important, because a lot of what we do as parents, um, some of it matters a lot and some of it doesn't matter so much. It's like Maslow's hierarchy of needs that we're all familiar with. We want to ensure our children's safety by addressing uh, the way we're approaching coronavirus and our isolation precautions. We want to make sure our children are healthy in terms of their mental health and prioritize their wellness. When it comes to academics, I think we should really try to give our kids and ourselves a pass that everybody is dealing with the same setbacks right now. And if children get a little behind, it's going to be okay. And if they miss a few Zoom sessions, it's going to be okay. I think setting your priorities it's a good time of year at the beginning of the school year to really choose a few things to focus on. The next way to cope with this reality is to lower your expectations, which, a lot of physicians are on the type A range, and they may hold themselves to high standards about like eating only the best things they can eat, or having their house be clean, or getting everything done all the time, the laundry done, etc. And sometimes we have to learn to let things go and be comfortable with that. So it's one way that you can try to make it more manageable right now. The other way is to recruit more help, either from your household or from outside. So, you know, in terms of thinking as a growth mindset, now is a great time to teach your children some practical life skills. So instead of only focusing on academic goals, now you may want to focus on making your kids more useful around the house, having them do more chores, having your older children learn to cook meals and learn to clean up after themselves. The start of a school year is a great time to set new expectations for family members in that regard when it's possible. And sometimes it's a little more work on the front end, but over time it will pay off. I'll give you an example. My son, he's 6, and I've been working basically since the pandemic started to get him to fold and put away his own laundry. And it took about 3 months for him to really do an acceptable job, and it required me to lower my expectations about how his drawers look. But now, instead of dealing with his laundry, I just leave it by his door. So, I don't know your family and your specific situations, but any way in which you can offload your responsibilities is going to help you cope better during this time. So that's one example. In terms of outside help, this has been the subject of a lot of debate because obviously every exposure during this time carries risk. A lot of people have extra concern also if you're in a high exposure field that you may bring home more virus than the average parent. I would say that the data from New York City, at least from March to May, when really PPE was not broadly available, it was remarkable that at a time when the community had about 19% with coronavirus, the healthcare workers had about 5%. So just because you're in a higher exposure zone doesn't mean that you're more likely necessarily than other people in your community to bring home the virus to your family. And along the lines of help. So I don't know the ages of everyone's children here, but people talk a lot about daycare versus a nanny. And there's a couple of physician-specific things to mention. So there's a thinking trap that happens when everyone just says, oh, a nanny is one person, it's obviously safer. And before you say that, you have to imagine what the nanny is going to be doing. So in a daycare setting, these are regulated environments, and they're held to standards. So depending on what's happening in your community, in my community, they're masking, they're sanitizing, they're doing health checks, they're doing all these things to decrease the risk. And sometimes when you choose to pursue a daycare setting, that's all of the exposure your child carries. Whereas if you choose to have a nanny, you may be arranging like play dates and playgrounds or classes where your child may encounter other people in less standardized environments. So it's important not to prematurely make your decision without considering like what the reality of the full situation is going to be. You know, I think most of you have made your decisions about school by now, but when people were making decisions about school, I did encourage parents to think through their exposure, because we've seen from the studies that there is a risk that your child will bring home a virus to you. Um, but even when the children are coronavirus positive, the studies vary, but it looks like only between 5 to 20% of those children infect someone in their household. So, your children's contacts are indirect contacts of yours, not direct contacts. So when you as a parent take on more responsibilities for directly facilitating your children to socialize with their friends or do their sports, you are likely to have more direct contacts with their friends, which may increase your risk. So, you know, a lot of parents prioritize the health and the wellness of their children over themselves, and they think more about protecting their child. But I would encourage you to think more about protecting yourself, because we know adults are at higher risk from coronavirus, and your children depend on you to be healthy. So as you approach some of these decisions about how to obtain more help for your household, you have to think about your contacts and your safety in addition to your child's safety. Um, so, okay. So as you can tell, I'm more worried about parents than I am about kids, because I spent the first half of this talking only about parents pretty much. So I assume that you all are familiar with some of the data about children and coronavirus. I've read pretty much all of it. And the numbers are really very reassuring. We don't want our children to get coronavirus because we don't want to take any chances with them, and we don't want them to contribute to community spread. But the risk to most children, if they do get sick, is quite small. So specifically, the most recent numbers I've seen for the MISC are like 3 in 10,000 children who have coronavirus will come down with MISC. And of those, most will be hospitalized for about a week and experience a full recovery. Obviously, some don't, but um, you know, of the 570 cases, 10 children have died. But out of the 1.6 million children in the United States that have had coronavirus, that's a very low number. So while it's scary to think about some of these rare complications, it's important to keep the perspective that they're quite rare. In terms of which children I worry more about, I would just review that the kids under 2 months, as we always have considered them high risk for infection, we continue to feel that way about coronavirus. They're among the most likely to be hospitalized, though it's hard to say how many of those hospitalizations are precautionary, because most of the hospitalizations are very brief. They're like less than 2 days on average. So I think, when a newborn has a fever, they get hospitalized for a sepsis rule out, and most of that is what we're seeing in that age group. We are seeing that after that, the teenagers are probably at disproportionately high risk, but still much lower than the risk to adults. Other risk factors to consider in kids are, severe immunocompromise and heart disease would be the two biggest ones I'm concerned about. So in terms of your parenting decisions about your kids, I talked earlier about prioritizing your own self-care, and I'd like to also prioritize your child's self-care. So in all the back to school plans, I've seen very little attention paid to ways to keep children active. I think that kids being physically active is a big priority. physical activity is essential. It promotes good sleep, good mental health. It promotes all sorts of important things. It even has been shown to improve your immune system, right? So there was one study I looked at where adults who exercised 5 days a week had a 40% lower chance of getting a cold over a 3-month period. So it's just worth remembering. It's super basic, but finding ways for your child to be active. It's easier said than done, given the limitations our children are under. So um, there are fewer facilities open for children to play sports and things like that, for example. So while most of the country has been scrambling to set up these like homeschooling pandemic pods, I've been more concerned and encouraging people I know to set up pandemic activity pods, because I think one of the most important ways you can get children to move is having children together. So it would be ideal if you can find a family with similar philosophy regarding your coronavirus isolation precautions, so that you could really um, let your children play together. So playgrounds, in terms of a way to get activity, they received a lot of flack early in the pandemic, and they were closed for a long time. But provided that the playground is not too crowded, I think a playground does pose an acceptable risk for most children. So we obviously realize that playgrounds aren't clean, and fomites can spread coronavirus, but there's also a lot of benefit from using a playground. Running and jumping and climbing, these are important activities to promote children's development. So I personally would find that to be an acceptable risk for my child, provided, like I said, it wasn't too crowded. You can always mitigate the risk by hand hygiene and not eating at the playground, and wearing a mask if you do feel it's crowded. Um, So, in terms of sports, there aren't a lot of resources that provide triage about which sports are the highest risk or the lowest risk. The CDC put something out, but it's pretty vague. Obviously, sports that are done indoors are higher risk than sports that are done outdoors. Some sports like biking or swimming or running, tennis are relatively low risk, while other sports like soccer and basketball require closer contact with larger groups of people and are inherently a little higher risk. I'd also put indoor sports like volleyball and dance and gymnastics in that kind of intermediate category. Then the highest risk sports are the ones where close contact is really inevitable. So the wrestling, for example. So I think it's worth spending an extra few minutes to think about your own children and their activity plans. How can you make sure that they do something to get moving every day? Because it will make it easier for them to be effective in their remote learning if they're getting adequate activity. I'd also encourage us to advocate as physicians in our local communities for encouraging schools to think about this too. Ideally, schools, we're all taxpayers. The public schools are resources. So even if the school is closed for remote learning, it would be ideal if they could allow students to use tracks or gyms, even if it's on a very limited basis with a lot of rules. I'm very worried about a whole school season of New York City kids not moving, because we've seen children having a lot of weight gain during the pandemic. And not just for the weight gain reasons, although we know as physicians that being overweight can carry a lot of morbidity. I think it's important. The next category of, how I would encourage you to watch out for your children's wellness is their media consumption. So we as adults are dealing with media overload right now, but our children are too. Even if you try to limit screen time, um, you will find that your children are hearing all sorts of things about coronavirus from the radio, from their friends, everything. So it's important to be aware of what your children are overhearing. Frequently, I've found that even if I'm having a conversation with my husband in the kitchen and my kids are in the playroom down the hall, they pick up on things. And if we're discussing and arguing about different activities and whether or not we'll be doing them, they overhear things. And sometimes that can be damaging or cause anxiety in the children. So it's worth being mindful what your children are consuming in terms of coronavirus news. I would encourage you to establish a routine of weekly check-ins or family meetings. This could provide an opportunity for your children to ask questions and for you to check in to see how they're doing. You know, you could all discuss your weeks. You should start by discussing like the logistics of your week. You know, if somebody has a lot of work one day, or if there are certain commitments that you're doing, looking at the schedule, then you can discuss like what went well last week and what didn't go well, what kind of problems were there in the household. And I would encourage you to use this as an opportunity for shared problem solving or group problem solving. Really, this family meetings are more for kids over 5, but if you have multiple children, certainly the younger ones will learn by watching all the discussions going on. So you would be really surprised to see how children can work through some of their own struggles in this regard. When we first started doing family meetings, my struggle was getting my son um, to do piano lessons and doing his piano practice every day. I was yelling at him about it, and I didn't want to be that mom who was yelling at my child. So instead of me trying to do it on my own to fix it, we brought it up at the family meeting, and we said, like, let's make a list, let's brainstorm all the different ways and then decide. And so we did it. And my son had suggested practicing right before bed, which was not something I at all wanted to do, because that is the time of day when people are tired and grumpy, and it wasn't a good idea to me. But because he suggested it, and had a desire to be the one that came up with a solution, you know, we decided to give it a try, and it worked. And I think you'll see that if there are problems that come up in your home, sometimes your children may suggest things that you wouldn't have thought of. And it can be a really great opportunity for creativity. The other thing that can come up at family meetings is that children may be worried or stressed about things you wouldn't have predicted. So it's easy for us as parents to assume that if our children are struggling, it's for the obvious reasons. But you don't know unless you ask, and sometimes it might surprise you. So my son, a couple of months into lockdown, was really upset because he had left a certain book at school, and he really wanted to read it. And I never would have guessed that that book was so important to him, but it was great to know, because then I could fix that. I couldn't help reopen his school or get him to go to his teddy bear picnic, but by knowing that that was what was upsetting him and him sharing that at our family meeting, I was able to help address it. In terms of kids with anxiety or depression, I think during this time, you know, anxiety and depression in kids is really common all the time. Like nearly 8% of children have issues with anxiety and depression, clinically significant. So now with all the stress and isolation, I'm sure it's even more common. So I think a couple of tips for how to recognize it in your children. First, children who are school age or younger don't always show obvious symptoms like sadness. You may see things like regressions, trouble sleeping, new fears of the dark, um, accidents with potty training that you haven't seen in a long time, clinginess, limited attention span, or you may hear them complaining about like stomach pains or vague pains. So if your child is having those kinds of things, just have the index of suspicion that you have as a doctor to consider that it may be their mental health. And you know that I think what happens when you think your child is struggling is immediately you jump to feeling guilty as a parent, or sort of catastrophizing things. So it, most children will have difficulty with this time. It's almost abnormal not to have a difficulty during this time. And by encountering a difficulty with support and overcoming that difficulty, this is a real opportunity for us as parents and as pediatricians to teach coping mechanisms to our children that will help them as they encounter difficulties later in their life. So for all of the hardship of the pandemic, we do have more time with our children, and teenagers in particular are around the house a lot more and more engaged with their family than they would have been otherwise, simply because they don't have an alternative. So with that comes an opportunity to try to help children develop some skills to manage uncomfortable feelings, whatever they are. I would say that there's not any data about how children do from a pandemic lockdown. The closest thing is that with the MERS outbreak from a few years ago in the Middle East, there's one study about how children did during that lockdown that's particularly startling, and showed that after a 2-week lockdown, nearly a third had post-traumatic stress disorder. I don't bring that number up to scare you, because what we're doing in this country is not what they did there, which was much more regimented lockdown, where you're away from your home and in a facility kind of thing. So I hope that we won't see those kinds of numbers, but I would just say that it is a huge stress and it is a huge strain. And so we need to keep an eye on our children and have a low threshold to ask for help. So telemedicine has opened up a lot of avenues for connecting with child health specialists in a safe way, whether, to start with your pediatrician, but know that there are therapists available if you think your child may need more of an evaluation for their mental health. It's not a sign that, your coping has failed, but it's an opportunity to provide your child with more resources to feel better and feel better quickly during the pandemic. I'd also recommend that if your children are engaged in school, that you try to be in touch with your teachers if you feel like your child is struggling. Remote schooling was a real disaster for a lot of people. And hopefully this school year, if your children are virtual learning, the school has had more of a chance to prepare. But if your child is struggling or hating remote learning, and every day is really a difficult day, I would strongly encourage you to speak with the teachers. I think they can be resources for helping us advocate for our children and figure out what to do if remote learning is not working. Just a few quick tips about remote learning, and then we'll do the questions because I'm going a little bit over. But with regard to remote learning, I just encourage you to keep your expectations consistent with your children's development. So it's not realistic to ask a kindergartner to plug in for 8 hours without support. Children before 2nd grade are going to require a lot of support for remote learning. Also consider the environment where they're trying to learn. And the ergonomics of their setup. So if you do need them to sit still at a computer screen, you need to make sure that they're, maybe they have a footrest and a backrest, so that they're in a spot where they're comfortable. Also, don't forget to check to make sure that the audio is not too loud. We don't want any chronic noise overload to damage children's ears. So on that note, maybe I will open it up to some more questions. I think I went a little bit over, but.
Thank you so much. That was so great. We have one question about the social emotional health of the smaller kids, being that school is so hands-on and play-based, and how do you mention a couple of ways of coping with that, kind of like the family meetings. I thought was a great idea. What other thoughts about protecting their mental health can you recommend for the
about social skills, right?
Social emotional, like to prevent the
Yes.
anxiety and just
Yes.
everything that goes around the virtual learning.
Yes. A lot of parents have been worried about their social skills and because school provides an opportunity to socialize and get used to a classroom environment and be around other kids all the time. And if your child's not in that environment, what I would say is that you shouldn't discount all the socialization you provide for your child. So when you look at curriculums, like Illinois State published their social and emotional learning curriculum is available online. You can just read it. And all of the domains of social and emotional learning are things that you can encourage at home. So to label your emotions and to learn to know what makes you unique. That's like there's three pillars. The first pillar is about, knowing yourself. The second pillar is about knowing others. And the third pillar is about like problem solving and decision making. So these are things that you can support in your interactions with your children at home, whether it's reading a picture book and talking about some of the conflicts that you see, or doing other activities like that. The other thing, virtual communication matters too. So I think that it's overblown our anxiety about social skills, and that our children will be okay.
Thank you so much. Let me see if I have any other questions. Any advice for kids that are actually going back in person in school? Because in the DC, DMV area, most schools are going to go virtual, but there's still some schools that are some private schools, and then obviously in other states that are going in person. Any advice that you can recommend for the parents?
I think the toughest thing, and you probably see this too as a pediatrician, is that when the kids are back together, there are going to be things that come up. So, kids will get sniffles and coughs, and it just happens. And it doesn't necessarily mean that it's coronavirus, but we have to assume that it is until proven otherwise, unfortunately, in this new normal. So I think it's important to set the expectation for your family and for your children that there may be a time during this school year where your family is isolated again, because it could come as a tough surprise for children, especially after what happened last year,
Mm-hmm.
if it comes out
Mm-hmm.
of the blue. So to just set the
Mm-hmm.
expectation that either someone in your class might get it, or you might have a fever and we might not be able to know for sure that you don't have it, and you might have to stay at home for 2 weeks. To know that that's a possibility may help make it less of a crisis when it happens.
Mm-hmm.
Um, and I think the other side of that is, as working parents, it's a stressful thing to have to think about what your family will do when that happens. But it I think we should be prepared for that to happen this winter. I mean, just statistically, the odds that either your child will be sick and you'll have difficulty ruling out coronavirus, or that somebody in the class will have it and the class will lock down for 2 weeks, we need to plan
Mm-hmm.
ahead for that possibility, so we're not panicked when it happens.
Yeah, definitely. I agree with that. And it is really important to think about, because sometimes we don't think about talking to the kids about the specific things that could happen, but it actually would help with the anxiety if it actually happens, because they already expect it and are prepared, rather than the stress of just all of a sudden I have to stay home. That's a really good point. And I think the family meetings that you mentioned are a great idea, and they would help for that. Um, Thank you so much. The main question also that I've been getting a lot is kids having developing like this negative attitude when things are not working with the virtual learning, like just the frustration and being like, I need you to help me, mommy. I can't do it without the support. So how do you set up for the growth mindset? I really like you that you mentioned the growth mindset, because it's really important for this time.
Mhm.
Do you have any resources that you recommend for like trying to instill the growth mindset at home, and or if you have put any posts on your Instagram, I think that's going to be a great tool.
Yeah, I think it can be very helpful. I think it's hard. So I think you have to set that expectation that it will take time. Then I think as parents, teachers, one of the things I've learned about teachers through this experience is that they're incredibly patient. And my friend actually wrote a book called How to Build a Better Teacher, which I read a few years back, which is so interesting. And it talked about learning theory and the idea that when we help our children with their work, sometimes we make them learn less, because struggling with a problem is actually how they learn new skills.
Mm-hmm.
So I would encourage parents to to welcome mistakes and praise effort and physically be unavailable to provide like very, very hands-on help. Say like,
Mm-hmm.
oh, that does look tricky. Why don't you work on it for 5 or 10 more minutes while I take care of this, and then I'll come see. And hopefully in giving your child that opportunity, even though it may be uncomfortable and they may whine, they will make a little progress. And if they don't, hopefully they'll write something down, or you'll learn something about where they're stuck. But I think if you don't provide the opportunity, um, you're putting both you and your child at a disadvantage in terms of actual learning.
Definitely. Okay, any more questions? I don't see any more questions at this time. Dr. Hay or Pia, do you guys want to add anything?
No, I would just like to thank both of you for speaking and presenting today. This is a very valuable topic and something that many physicians and parents have been asking a lot of questions about. And so I think today's discussion has been incredibly useful. And I would be remiss if I didn't mention for the DC physicians, the new Healthy Physician Program is available to you if you do have any of the things that were talked about, discussed today. If you do need to speak with someone, that is also an option.
I'm gonna put the support line.
Oh yes, and as well as the support line, of course. And I would be remiss if I did not mention Dr. Fraden put the link to her book in the chat. I personally have purchased it. I'm looking forward to reading it more than the skimming I've been able to do at this point.
Mm-hmm.
So that is an available option as well. So without further ado, I'd just like to thank everybody for participating, and go be a great parent that you are, and have a great day. Thank you, everyone.
Thank
All
you,
right,
everyone.
thanks so much for having me.
Thanks, Kelly. Bye-bye.
Bye.